A hopeful snapshot showing substantial progress in fighting HIV/AIDS. In the Central African Republic, with teams going into small communities and making antiviral treatments more widely available. Between 2010 and 2021, globally, new HIV infections decreased by almost 22%, and HIV-related deaths decreased by almost 40%.
The biggest takeaway is that progress is possible, but it will require sustained focus.
But in Canada, HIV cases are going up. According to the latest numbers from the Public Health Agency of Canada, between 2022 and 2023, there was a 35% increase in new diagnoses. And while the disease is no longer a death sentence, Canadians are still dying of it. 1,597 deaths were attributed to HIV between 2013 and 2022.
The problem is that we forgot.
This doctor, who's been fighting AIDS since the 1980s, fears the same old stigma remains.
The 80s was a new disease, killing people, no treatment. Now we have treatment, it's a chronic disease, but it's more difficult to do education and prevention.
Prevention through self-testing or taking a daily pill, also known as PrEP, which virtually eliminates the risk of contracting HIV. In Saskatchewan, which leads the country in new HIV diagnoses, community workers say education and outreach are key.
We stress the importance of practicing safe sex, using protection, and when you use substances, never share your needles.
Also important, experts say, focusing on those who already have a hard time accessing care, like those experiencing homelessness or poverty.
If you don't have a place to live, why would you worry about being tested for HIV?
She says culturally sensitive solutions by and for those who are disproportionately affected, like Indigenous people, are key to stopping the spread of HIV. Jennifer Yoon, CBC News, Toronto.